evening, good evening, good evening. How are we doing? Hello, hello, hello. Good evening. How are we doing today? I hope you've had a good day. Can we believe it's September already? Oh wow. Oh wow. I'm just gonna give you a minute or two and let people join in so we can start today's conversation. And today's conversations around ovarian cancer, some myths and facts, about ovarian cancer. September is Ovarian Cancer Awareness Month as well as PCOS. I think next live conversation we'll be talking about PCOS. This is the Feminine Health and Fiber Support Network, and we are a charitable organization. We provide support in our community through relevant conversations like this one. We try to talk about things that affect a woman and feminine health issues. And we also support with hand-holding, peer-to-peer support. We have a hub of about 150, 60 women, I think it is now. And we give education, lifestyle guidance, experience sharing, nurturing, signposting. We just generally encourage women to talk about the things that they're going through or might be going through, especially regarding feminine health issues and mental health. So this is what we do. But today I have a doctor friend of mine who we're gonna share some. He's gonna, I don't know the expert he is. He's gonna shed some light on ovarian cancer, just to bust some of the myths, and give us some facts. But as in my usual tradition, I'll bring us hope. But for me, this is letting women know that there is hope, and the scripture that I wanted to share today is oh, I thought everyone was gone for a moment there. Hello, thank you everyone for joining. The doctor kind of dialed in and that threw me off for some reason. So as I was saying, Jeremiah 30:17, I like the Message translation especially. It says, as for you, I will come with healing. This is the Lord speaking. I will come with healing, curing the incurable because they gave up on you and dismissed you as hopeless. And for me, honestly, hello everyone who's joined, is about bringing hope to women, letting you know that there is hope. It's all about he's done now, the doctor's now joined. It's all about getting in the community where you can speak up and get the help that you require. Also, Psalm 91:14-16 says, the Lord says, I will rescue those who love me. I'll protect those who trust in my name. When they call on me, I will answer. I will be with them in trouble. I'll rescue and honor them. I'll reward them with long life and give them my salvation. And honestly, for me, that's my bottom line. And I want to also invite anyone who hasn't got a relationship with Jesus. That is the bottom line. Knowing God. And we see the promises that he has made, that he'll protect those who trust in his name. So come and enjoy and be part of knowing Jesus. I'm just going to try and bring the doctor in. Today we are talking about ovarian cancer. And he's going to help us with some facts so that we're informed. A few people. We have amazing people who want to share their thoughts as well. I'm just trying to bring in the doctor. Today we are. Okay, I got you. Okay, hi, Dr. Shegzi.
Hello, how are
Hi,
you?
how are you?
I'm good, thank you. And
Okay,
you?
very well, thank you. Are you stable? Are you about moving? Are you moving?
I'll get stable in a section.
Okay,
Yeah.
amazing, amazing. Thank you for coming today, as you will usually support this charitable organization. Once you're ready, I want you to introduce yourself. I was saying that this is the Feminine Health and Fiber Support Network, and we're a charitable organization. We offer solutions and bring information, education, concerning feminine health issues. Fibroid is close to home, but also we create awareness and education around other feminine health issues. And today we're talking about ovarian cancer. It is September. September is awareness month for ovarian cancer as well as PCOS. So today we need your help with some facts, so that we can bust the myths around ovarian cancer. So introduce yourself first, Doc, and then we'll take you from there.
So, my name is Dr. Olusegun Ilesami. I'm a consultant obstetrician gynecologist working in the NHS here at Shrewsbury, and just joining today to for us to have a conversation about ovarian cancer.
Mm-hmm.
And this is always an important thing to actually talk about, especially because of how important it is for survival rates and things like that.
Amazing, amazing. So for general overview, ovarian cancer is the type of cancer that affects the ovaries, and this is where we come in as women because we've got ovaries. Can you hear me, Doc?
Yes, I can.
Yes. Okay. Yes. And some of the common symptoms, and for me, it also is a tricky bit because it can mirror some other well, I wouldn't say number, other kind of feminine health issues. Some of the common symptoms include constantly feeling bloated, a swollen tummy, discomforts in your pelvic area, feeling full quickly when eating, and needing to pee more often than usual. And sometimes even those are kind of those also can mirror symptoms of, if you like, menopause, you know and
Or
so
a
for
symptom of water
uh,
infection.
yeah, and
Mhm.
something, I mean, so for me that's really interesting. And at one point, would you know? And anyway, before I just jump all over the place, let's just take you one step at a time, because also detecting that you have, or early detection, how do you go about that? Because it's not your usual or the most common kind of test that you do to discover if you have it. So one myth that I wanted to discuss first is around that ovarian cancer only affects older women. Tell us a bit about that.
So first, it's if we talk about detection, so that's us going. We can go into that straight away because that is the difficulty with ovarian cancer.
Mm-hmm.
So with ovarian cancer, it is difficult to detect early, unlike be it skin cancer, cervical cancer, and indeed some other types of cancers, breast cancer. And
Mm-hmm.
now that's because the ovaries are in a woman's tummy.
Mm-hmm.
They are deep inside, and it's not something that your doctor or the lady herself can actually feel in order to know that there's something going wrong on the ovary. Then, unknowingly, it doesn't start to show symptoms early enough for one to at least go to the doctor so that the doctor can do an ultrasound initially and maybe a blood test.
Mm-hmm.
In terms of age, ovarian cancer can affect a wide age range, because there are some we would call them like childhood tumors that can occur on the ovary. But commonly, the one we see commonly is it affects women that are usually in their 50s
Mm-hmm.
and above. Um, so, yep,
So that's common, but it doesn't mean that it cannot affect younger women.
no.
So I just wanted to
So it
just
can affect
bust that
younger
myth.
women as well.
Mm-hmm. Mm. So that's interesting. Thank you for that. Just highlighting that. It's not, it can be at any age really, you know. So we should not buy that misconception that's only older women that can have ovarian cancer. So
Yes.
okay, thank you for that. And the other thing that before we go to detection and all early detection, I was saying earlier on that, we can mimic I said menopausal symptoms, and you said also maybe urinal
Yeah.
tract infection.
So
So
that's the thing. It can
how,
mimic.
like, if a woman's got stomach pain, feeling
Mm,
bloated, you don't
yeah.
want to quickly say, oh, maybe the person has ovarian cancer. How do you then start to narrow it down to say, okay, if you get AYZ or combination of these symptoms, this is what you might be dealing with. How do you then go to say, can I get tested? And my other question was going to be around, do you just request for this test, or because I know it's not part of the MOT on the NHS. So how do you start to say, I want to get checked for this?
So more and more, especially in our own local practice here in the UK,
Mm-hmm.
um, there are some trigger symptoms
Right.
that you go to your GP with, and the GP automatically would do a blood test. So a blood test known as CA125 or
Mm-hmm.
CA125.
Mm-hmm.
This blood test the GP would order for, and the GP would also order for a scan. Now, this would be when someone in the, sort of right age group is complaining of bloating, and especially when they report that they have tried some initial measures of what might be a common cause of bloating, be it drinking milk, it might be eating certain kinds of foods, and it might be that they notice that in addition to other symptoms, some of which you've already mentioned. So they are noticing almost like pressure passing urine. They eat only a little and they feel full. These can be some of the telltale signs that might make the GP just initially start to do some tests. It's difficult to just get any one of these vague symptoms and then suddenly just request for an ultrasound scan,
Mm-hmm.
uh, because at the end of the day, there is no good screening method for ovarian cancer.
Mm-hmm.
So we don't really have a good screening method for it, and it's not a routinely screened for disease, at least in the general populace.
Wow, it's interesting. It's interesting you said that, because earlier on we had said that. Well, you had mentioned, and I had also actually asked if it was only for in older women, and we had said it could be any age really. But now you've also said that a combination of some of these symptoms, when you go to your GP, is at a particular age, then you get offered the CC125 test, or
Yeah.
and for me, it's like, God, that could be something that's been happening for a while, and waiting until you get to a certain age to say, okay, maybe this is what we should check for. And then maybe by then it's progressed too far and all of that. So it's the challenge for me in my head is, how can this be detected early? Okay, except maybe you have family history of one of those cancers before somebody checks, or I don't know. I don't know, just something playing in my head,
Mhm.
you know.
So it is even for many gynecologists, that's always the big conundrum because of where the ovaries are. It is
Mm-hmm.
possible for the ovaries to develop a cyst or develop the cancer,
Mm-hmm.
for it to carry on and become quite large before we find out. It is possible that, especially with cancer, most cancers are staged stage 1 to 4.
Mm-hmm.
It is possible that around the stage 1 and 2, that nobody is any wiser that there is this cancer developing, and even the patient would not have made any complaints, at least relating to what we might eventually find was an ovarian cancer. It
Mm.
could be in the later stages, which is what we see even
Wow.
here in the UK,
Mm-hmm.
that we would start to detect some symptoms
Okay.
when, and then when tests are being done, we would now find the ovarian cancer.
And
So,
at that
and the
time, your
problem with
prostate
it is,
has progressed.
yes, it would be stage 3 or even stage 4 cancer by then.
Wow.
Um, and it is just really because of how deeply sighted the organs are, and the symptoms they produce are just very vague symptoms. Some of it we call them constitutional symptoms of cancer. You would have, just pains that you can't really describe exactly where. You might seem tired
Mm-hmm.
more frequently than you used to be.
Mm-hmm.
You might have a fever that you can't just seem to shake. So it will just be really weird symptoms that they need to investigate. You would, especially common might be weight loss, and then there might be bowel changes. So, we talked about
Yeah.
bloating. Then
Yeah.
when there are bowel changes, people are more likely to start to think they are developing some sort of bowel condition.
Mm-hmm.
And yeah, all of this would make it difficult for even the GP that you see initially.
Mm-hmm.
For the gynecologist, you might see afterwards as well. And that is why they are better helped by doing scans.
Mm. Wow. Wow. Honestly, for me in my head, and it's as I mean, as a woman or any woman, you because you don't want to be paranoid that okay, I have this pelvic pain or I'm having difficulty with, I'm going to be
Yes,
going to ask for a check, but at what
yes.
point do you think, okay, I should be pushing for all of these tests that can help detect if there's something, wrong with the ovaries? It's a challenge that I'm trying to get around in my head. Like, at what point should a woman now start to push or put their foot down? Like, okay, no, I want that C125 test, or I just want to check things, you know? Or, mm, mm,
And this is the thing. That is why it is, if you think about it, especially, well, here in the UK, we have screening programs for cervical cancer.
mm-hmm,
Now, the screening program for cervical cancer, it lends itself to being able, ease of screening, because you can examine inside the vagina, look at the cervix, and then take a smear test from the cervix, which you can see. You're not cutting into anything. You're not needing it to bring someone into the hospital per se,
mm-hmm,
and you're also not needing to anesthetize anybody, for example,
mm-hmm.
to do
Do
that.
that.
It's not expensive to do this training, at least for the particular unit, one person. Of course, when you upscale that to across a population, it is expensive to run screening programs. But once you're now able to, so you can see the cervix and you will know whether it looks normal or not. You can take a smear from the cervix and send off to the lab.
Okay.
And these days they will check that smear for HPV. Once it is HPV negative, then it is just immediately understood that there can't be any signs of cervical cancer developing. Now, the ovaries,
Yeah.
because of where they are,
Mm-hmm.
we can't actually get women to come into a clinic, stick a camera into their belly to look at the ovaries. So, which is the beginning of how difficult it is to do a screening program for it. It's useful for women, especially as they approach their 50s and start going past 50 years old. that they start to understand some of the risk factors that they might carry themselves. So, are they overweight? Have they had endometriosis in the past? Do they have diabetes?
Mm-hmm.
Have they had other cancers before? For example, bowel cancer. Do they belong to, does ovarian cancer run in their
Okay.
family? Have they left, for example, have they had children before? And so on and so on. So once you know some of the risk factors that can
Mm-hmm.
be linked to you, then it is possible that you want to see your GP for that screening.
Okay.
Do you
Mm-hmm.
say it? So, which is the reason why it is important that when we get some of these symptoms we've been discussing, bloating, you feel that your bowel habits have
Mm-hmm.
changed, and you think you're losing weight without really
Right.
trying, you're finding it difficult to keep to eat your usual amount of food. These will be reasons why you would see your GP. And lucky enough for us in the UK, the GPs would usually see you with a pro forma that can ask some of these questions.
Yes. Right.
And once some of these questions are being answered in the positive,
Mm-hmm.
then the GPs would automatically do a blood test for you,
Okay.
and then they would send you for an ultrasound scan.
Right. Okay. So, I mean, I guess the rule of thumb is if in doubt, just ask for the test, especially if you're past a certain age or approaching a certain age, and just, I guess, ask for the test.
They
Um,
will triage you. So just so that we one understands it, I can speak for what is in our sort of local practice here.
mm-hmm.
They will triage you
Hmm.
using that form
Okay.
so that they are able to tell whether you need to progress further.
Right.
So it is possible they do the blood test, and the blood test is entirely normal,
Mm-hmm.
and they do a scan and there is no cysts to be seen on the ovary. The ovaries themselves look normal. It allows yourself or the patient and the GP to start to think of other causes for the symptoms you would have gone to the GP with.
Right. Okay. Thank you for that. Thank you for bringing
Mm.
clarity into that. Earlier on, you talked about ovarian cysts. So, how are they similar to ovarian cancer? What's the difference? Because there's a myth that ovarian cysts are similar to ovarian cancer. How is that true? Is that fib?
No, so the way to think of it is, if you think of it almost like the ovary looks like, if we use an analogy like a boiled egg.
Mm-hmm.
So the ovary itself just looks like the boiled egg. So you can see it, it's white boiled egg.
Mm-hmm.
Then just imagine if you were able to attach a tiny balloon filled with water, can be
Mm-hmm.
filled with other things, but a tiny balloon filled with water, and you attach that onto the ovary.
Mm-hmm.
Now that is an ovarian cyst. Does that make sense?
Yeah.
Yep. So now the thing with it is there can be simple ovarian cysts.
Mm-hmm.
Now that fluid-filled sac that one sees, women develop that every month as they recruit eggs in order to be able to have an ovulation.
Okay.
Now, when they ovulate, initially, if you think of it almost like that tiny, it's almost like um, a tiny cyst, a tiny capsule
Mm-hmm.
open, almost like it opens up and releases material that can get fertilized.
Mm-hmm.
Now, the leftover of that capsule,
Right.
almost like if you think of it again, I would use an egg again,
Mm-hmm.
almost like the eggshell is left behind, and the eggshell can take on water, it can take on blood vessels, and it is possible, and it would now start to produce hormones that will keep the growing pregnancy alive.
Mm-hmm.
Now, if a pregnancy event does not happen, all of that shrivels up and gets absorbed
Right.
back. For some ladies, that reabsorption does not occur as easily or as quickly, and so people are left with physiological cysts. We know that over three or so menstrual cycles, these slowly reduce in size or even or disappear.
Okay.
Yes. So that's how an ovarian cyst can be different from ovarian cancer. Now, ovarian cyst, it depends on when we find it, how big it is, are they multiple, are they on both ovaries, and what age we're finding
Mm-hmm.
it. So that is why our local guidelines will have a difference between how we manage ovarian cysts in someone that's gone through the menopause and someone that is still premenopausal. So someone who is still having regular menstrual bleeding.
Mm-hmm. Mm-hmm.
Because we've already talked about how ovarian cancer can be common in ladies that are that are above 50 years old.
Mm-hmm.
If we were to find an ovarian cyst in someone who was 70 years old, and the ovarian cyst itself was already measuring above 4 or 5 centimeters or even 7 centimeters,
Right.
and it did not look like a simple, like I described it, a simple balloon
Mm-hmm.
filled with water. Rather, it looked like a balloon filled with water that you added a few stones into the balloon filled with water, and you added some powder in there.
Oh.
So, in other words, you're making that cyst complex.
Mm.
So, once it becomes a complex cyst, older individual, and then you're seeing it causing the CA125 to be high, then that is most likely an ovarian cancer. Of course, the one way we would know finally is when we take out the ovaries with the cyst or with the swelling, look at it under a microscope, and that is when we know that that is actually ovarian cancer. So there are other so cysts generally, ovarian cysts can be common in all age groups. Some of it, like I said, can just be as part of just monthly
Okay.
cycles.
Cycle.
Some of it can be some persistence of that activity of a monthly cycle. Some of it can even be cysts that we carry from childhood, and these are known as dermoid cysts. They might look a bit complex, and if you look through the literature, it will let you know that in places where these dermoid cysts
Mm-hmm.
have been removed, especially when they've grown quite large,
Mm-hmm.
they are benign. So, in other words, they are not malignant. Then, when you open them up, sometimes you find hair, teeth, bones inside it. So,
Is it
so this is
teeth?
something that would have been carried from a long time.
Wow.
Um, and it is not unusual that for some individuals, we only happen to find it because we've done a scan and they're already well into their 50s by then.
Mm.
It is also possible that you can have a description of a cyst, like I said, a complex ovarian cyst. Now,
Mm-hmm.
that's when it is not simple, it's just think of it like the balloon filled with water. And once you start having a bit of bleeding into it, you start having it looking like it has what is known as daughter cysts. So where you can see the balloon filled with water and then there's some added cysts all around it.
Mm.
Then these are markers that make us start to worry that we're seeing features of some sinister features of an ovarian cyst. So yes, when you do a scan, and you see a cyst, you want to take a closer look because it is one way of identifying whether there is beginning to be a problem in an ovary.
So, will the symptoms of ovarian cysts mirror ovarian cancer symptoms? Which
So
get you to check?
well, the ovarian cysts, that's why there will be many young people that have had cause to see a doctor or a gynecologist, or indeed to have surgery because of ovarian cysts.
Mm-hmm.
Now, ovarian cysts, usually when they are small, about 3, 4, 5 centimeters, it is difficult to know, it might not bother an individual. But occasionally, once it starts trending above 7 centimeters, it can undergo what is known as ovarian cyst accidents. So these ovarian cyst accidents would be one of the ovary. Just think of it almost. So the way to think of it is if you had a string and you tied a string to or attached it to an orange, it means the orange would move any which way it likes. So the same thing, as soon as the ovarian cyst starts to get enlarged.
Mm-hmm.
It can cause the ovarian cyst and the ovary to twist on itself. So that's known as ovarian torsion. It can also cause some bleeding. So there can be bleeding into the cyst,
Oh,
and
wow.
that sort of tension can cause it to become painful. So for these two reasons, people might present to an accident and emergency with acute tummy pain.
Right.
It is also possible for the cyst to, in its own way, treat itself by rupturing. So it bursts, and the content would usually not be anything sinister. And in a way, that's how it resolves itself.
Right.
So you might hear some people will give you a history. Oh, I have an ovarian cyst. They've scanned me. It was measuring 4 centimeters. It was measuring 6 centimeters. Then come a few months later, you scan and you just can't see any cyst there. They would usually have keyhole surgery to look at the area
Okay.
and to deal with removing the cyst, and that's known as laparoscopy,
Mm-hmm.
and sometimes to even remove the ovary.
Mm. Okay.
So, and that's where the symptoms are different from ovarian cancer. So, with ovarian cancer, yes, it is possible for someone to present with ovarian cyst accident. So, in other words, the cancer is, and the cyst have become big enough that they actually cause some pain by twisting on itself.
Mm.
But commonly, the reason people will go to their GP because of something related to cancer,
Mm-hmm.
symptoms related to ovarian cancer, would be because of that what we discussed, bloating, weight loss whilst they are not trying,
Mm-hmm.
difficult to keep anything down or eat enough like how they would prefer.
Mm-hmm.
It can be some just vague symptoms like tiredness, like it might also be odd bleeding, constipation, diarrhea. These will be reasons why it might just initially throw off the GP,
Mm.
but eventually they can happen upon tests to do to help them.
Mm. Oh, wow. Wow.
Mm.
Amazing. Thank you for that. My other question around that is, so can the cyst become cancerous?
Um, yes, an ovarian cyst. This is the thing. It's difficult for us to know whether at the start. So that's a difficult study to do. It's difficult for us to see whether at the start you can see an ovarian cyst,
Right.
then watch it over the years till it becomes a type of cancer. What we struggle with is that when you see an ovarian cyst in certain age
Mm-hmm.
groups, the guideline would usually suggest you should offer certain actions. So if it
Right.
was in the younger age group, then the guideline would suggest that you wait to see whether it would shrink on its own, or it does not get beyond 7 centimeters, or it does not have any significant symptoms.
Mm.
Now, once one is dealing with someone who has gone through the
Mm.
menopause, the RCOG guidelines would suggest that you should offer the patient keyhole surgery to remove the ovaries, and if there is a cyst on the ovary, of course, remove that as well.
Well, mm-hmm. Oh, wow. Wow. Interesting. Interesting information. Thank you. Thank you so much
Mm.
for Dr. Shakes. Please put it in the chat. I will ask him for us. I've got a few questions myself, but before we go on, I know that we've talked on the cyst, we've talked about the screening test, and so most reliable is the CA125, and I guess um um the screening.
Yeah, that's the thing. So because there's no screening, you find that an ultrasound scan and doing the blood test, the CA125, it's a usual first step for us to start to find out what is going
So
on.
with an ultrasound, you can actually
Yeah, yes.
and
So the
then so.
ultrasound,
Mhm.
what they do is they scan through the tummy, and then with an abdominal probe, and then they also scan through the vagina using a vaginal probe.
Mm. Okay. All right. So, but women with family history are offered this test quicker than one without, right?
Yes, some women with family history of it's known as BRCA gene or Lynch syndrome. Now, these ladies would have obviously significant family history of a type of cancer along this line. So the breasts, the ovaries, and even the endometrium. So for that reason, these ladies would usually have some form of screening pathway. They might be more self-aware of symptoms they might be getting.
Okay.
Might have the opportunity of knowing a relative, knowing how a relative presented, and for them to sort of watch for some of these things. They might be more aware of the risk factors they carry, which is apart from the fact that they come from a family with the BRCA gene. So they might just be mindful that they are diabetic, that they are diabetic, that they've got a high BMI, and so on.
Mhm.
So these will be ways that for example, families might, you're correct, some families might seem to be able to get a diagnosis quicker or treatment quicker, or at least be able to see a doctor quicker.
Okay. All right. Thank you for that. And for women who might not be aware, so how do they get tested for this what did you call it? BRCA?
Gene.
BRCA.
Well, the thing
Yeah.
is, it would usually run in families, and because of just it's not a test that is offered without specific guidance or
Okay.
specific guidelines. So one, it's you might ask, so how do you know? There has to be an index reason why you would check in a particular family for it. So there will be people that they would find out because those people have cancer themselves, and it is in the course of testing and checking for the genetic basis of some of these cancers that they would now find that it's BRCA, and then all the female relatives in that person's family will be asked to test for it.
Mm. Okay.
But of course, yeah, here we're lucky that we would have geneticists that will work with us. You would have guidelines that make it easier for you to join certain pathways
Mm.
for you to identify those family members that might benefit, and then they would have their ways of contacting family members for those kind of with that kind of information.
Mhm.
So it's a multidisciplinary approach.
Right, right. Thank you. Thank you, Dr. Sheks. I also have another question. So,
Yeah.
we earlier on you touched on the fact that it's not easy to detect, and sometimes by the time we
Yes.
find out it's stage 3 or stage 4. So what do you what's the I have no idea what happened. you know, the I have no idea what's happened. The last session kind of just kicked the doctor out. Um, I don't know. I hope he can join back. I just had to finish that one and start this one, but I was gonna ask him a few questions. I hope the doctor is able to join. Sorry about this. The last session kicked the doctor out, and he wasn't able to join back in. And I have no idea what's happened, but hopefully he can join this one. Just to finish off, I had two questions to ask him. And I thought if anyone else had questions around ovarian cancer, today we're talking about ovarian cancer, the myths and the facts. And Dr. Shegsy was trying to help us with some education and information around diagnosis and how to detect. I can't see the doctor anywhere. How to detect ovarian cancer, but the challenge being that it's not easy to detect early because of how deep or how far in the ovaries are, and we're just exploring, how it's similar to ovarian cysts and what's the difference and whatnot, and if ovarian cysts can turn into cancers. So those were some of the things we were discussing. Well, now the doctor has not rejoined. Um, Dr. Shags. Well, seriously, I mean, these are things that we should talk about, and I was also trying to ask about the myth around it only affects older women, but I mean, it's mostly common in older women, but it doesn't mean that it cannot come up in any age, so age is no barrier. You're not too young to worry about ovarian cancer. It's something that we should all look out for. And ultrasound and the CA1212 blood test is how to detect it, but it's not something you just get offered, and especially only women with family history of some form of cancer will be offered something called BRCA1 or 2 to check, and which can then lead to further checks. I don't think the doctor is coming back on. Oh, it's 10 minutes to, and I just spoke to him. He said he was coming back on. Oh, Dr. Shegs, why are some of my doctors not social media savvy? Ask me if I am. I'm just learning as well. Okay, I'll see if I can call him on another phone and see if he can still join us. But if anyone's got any question, please put it in the in the chat so I can ask Dr. Shex when he comes back. I have about 2 questions of my own that I wanted to ask him, but I don't know why he's not able to come back in. And stop laughing at me. Social media. I am learning every day how to work this thing. Come on, Dr. Shexy. Actually, let's see if I can find him and request him to join. But he has to be on for me to request him to join. That's not him. That's Dr. Show. That's not him either. Okay, I'm gonna have. Okay, hopefully he gets to join now. We just have a few minutes. Thank you, everyone who's joined. Oh, there he is. Wise Shegsy. I was looking for Dr. Shegsy. He's called Wise Shegsy. Dr. Shegs, oh yeah, join please. Thank you for requesting. Go live. And we have 8 minutes to go. Dr. Shegsy, join. Accept you. Oh, I've done it twice. I hope it doesn't kick you off again. Can you hear me?
I can hear you.
Oh, praise God. Oh, wow. Eh, okay, thank you for coming back because I don't know what happened. You got kicked out and I just got frozen. Well, anyway, I put that other first half out. I was asking you a question before we got all these technical issues developed. So I was saying because how it's now you're getting fuzzy. Can you see me and hear
Yes,
me?
I can.
Okay.
I can. I can
Uh,
see you.
so, so I was saying because of how it's not easy to detect
Yes.
ovarian cancer, and so because sometimes you say it's up to you, I mean, you'll have advanced with third or fourth stage. So how do you help women manage after the diagnosis? Especially because it's not something that's been picked up early enough. And as a medical practitioner, how do you help those women? How do you support women, after discovering at this late stage that they've got ovarian cancer? What's the next step? Are you there, Dr. Shexy? Oh God, this man's frozen again. Dr. Shexy has frozen again. Hmm. Oh dear. I don't know what's going on. Ah, there you are again.
Yeah, I really don't know why it keeps sort of switching off.
I have no idea as to, but
And
let's.
it actually just says it like it gives you a message almost like you finished and you're ending the you're ending the live yeah.
I have
It's
not
always
done
just
anything like that.
I
Anyway,
know.
let's get to
Okay.
it. So I was saying,
So
how do you
yeah.
help women manage after they've been diagnosed? At stage 3 and stage 4, that's quite far into it. So how do you help women, support women as medical practitioners,
So I think
especially because
if we join in, it's just important to understand that just by virtue of where the ovaries are, so they are sort of attached to um, ligaments that help hold it near the womb itself and underneath the fallopian tube. So the mainstay of surgery, so the main thing doctors would offer is surgery to remove the ovaries. And because we're dealing with cancer, it's not sensible to try to just remove the ovary without removing the organs of near it.
okay,
So basically, they'll be offering a full hysterectomy. So they'll be offering the removal of the womb, fallopian tubes, the ovaries, and the cervix all together.
right,
They send off to the lab. It gives so the person in the lab, so the pathologist will be able to give us an analysis and let us know what type of ovarian cancer it is. Um, and then even at the time of
what types
surgery,
are
we're able.
there, by the way, before you go further?
So
So,
it's just their technical terms. Their technical terms we'll be using.
right,
So when we talk about mucinous and serous ovarian cancers, and then depending on which sort of cell line it is.
what does that
Uh,
mean in layman's language?
so that's what I mean. So in layman's language, usually it's just enough to know that you're going to divide it into something that when you look at it, you now think, oh, you know what, this is just benign. So in other words, it has not spread anywhere.
Right,
It does not contain any material that would have been sinister or dangerous, but there would have been no way of knowing until you sort of cut into it. Then there will be the malignant one, the one that it would, if you left it alone, it will grow. It will start to seed around the area where the ovaries are and the womb. It will start to send seedlings to further off organs like the brain, the chest or the lungs, and this would be when it is stage 4. So when it has started doing that, that is stage 4,
right,
and the prognosis is usually very poor. And that's why cancer is the mainstay. So you remove the all of what you can
okay,
see. At the time of removal, you'll get a sense of how what the spread might look like, at least locally. And then finally, you would now treat with chemotherapy. So that's using medication or drugs to be able to treat the cancer.
Are you there, Dr.
I'm
Sheggs?
here.
Oh, okay.
Can you hear me?
Okay. So you said, and so that's where you use drugs. That's the last thing I heard.
Yes, so that's when you now use drugs. So you use chemotherapy, drugs, to treat the condition.
Right. Okay. So statistics. What survival um numbers after this whole hysterectomy and using chemo to treat?
Difficult because it depends on population, won't it? It
Mm,
will be different, yeah, and it will also depend on the stage that the cancer itself is found.
mm,
So, very difficult to talk about survival rates.
mm,
You'll find that people are more able to say so when they now see what sort of stage it is. Um, I'm sure you would also need to look at someone's ability to take some of the chemotherapy agents, what sort of cancers they've had in the past, and so on. So it can be difficult, but usually the good thing is people will take anybody's particular risk
mm-hmm.
factors, they will use it to be able to give one almost like an approximate of
Right.
what they think would be the individual survival rate.
Right. Right. Oh wow, it's interesting. I was wondering, someone had asked a question earlier on around,
Yeah.
but I think you answered that question. It was around if you can pick up um ovarian cancer through smear test, and which you had said you had answered, and the answer was no, right? That is that just looks in the cervix, but the other one, the ovaries are they higher up or further out?
So that's it because they are deeper inside the tummy. So basically, the way you look at it is if you were looking in front of someone's tummy, you
Mm-hmm.
see the skin, there will be a bit of fatty layer, then there will be the muscles, the six pack, as they call them. And then within that, there will now be a thin membrane that covers the peritoneal cavity. Beyond that, the first thing you will see in that sort of area will be a bladder, will be the urinary bladder, especially if it's full. And then behind the urinary bladder is the womb. And the womb itself is sat central,
Mm,
and then there's these two thin tubes leading out of the womb at the top of the womb. Those are fallopian tubes. Now underneath, almost like the way we have our axilla
mm,
or our armpit, so underneath that way, that's sort of the area where the ovary
mm,
sits, where
mm,
your chest is the womb, your arms are the fallopian tubes,
mm.
and then just start there like putting a basketball underneath your arm. That would be where the ovaries will be sat.
Wow, right, right. Thank you so much for that. Dr. Shakes. Well, I mean, my what I would like to, I mean, put out for women is just honestly regular checkups and proactive approach is the um solution for any persistent symptoms. Honestly, so to be able to catch this early, because the earlier it can be caught, the better, and the higher the survival rate for ovarian cancer. But hey, it is what it is. But our God is a healer, so there's nothing he can't do. But seriously, for me, it's more important about educating and having that information to know that look, be aware. It's, I guess, creating that awareness
Yes.
and you know um being proactive in the approach if you have some symptoms or combination of these symptoms is just making sure that you have a checkup you know And like you touched earlier on, lifestyle choices, tell us a bit more about how that can help also in combating this or um reducing this.
Yes.
Mm.
Still hear me?
Yeah, yeah, can hear you.
Okay.
So I'm saying,
Yeah.
tell us a bit about how lifestyle choices can also help to
Oh
combat.
yes. Oh, I do apologize.
Yeah.
I thought you was making a commentary there.
Mm.
So we talked about certain things that could be risk factors.
Hmm.
So a lifestyle choice would be being aware of your own health
Hmm.
history. So it can be one's female relatives, their health history,
Hmm.
hearing what has been said, and of course, if you're lucky enough to live in a country like this where the genetic screening team can contact you
Hmm.
when they feel there's a possibility that you might carry certain genes. Then attend it for that, just so that you can at least be aware. It can be scary to know that someone is giving you a diagnosis to say, oh, yes, you carry this dangerous gene that can cause you to have breast cancer or ovarian cancer or womb cancer.
So
Um,
that's the BRCA 1 and 2. Is that the one?
Yes, so that would be the one. And it is also, so that would be one step. So, being particular about just knowing one's health history. Then, personally, it would be lifestyle choices like just if, you know, one develops diabetes, then it's to ensure that one is taking good care of diabetes and being aware that how that also might be a risk factor going forward. So, if you start getting early satiety, bloating, then it's one of those things that makes you go to your GP quicker. Weight loss, because high BMI is linked to these as well.
Hmm.
Then also other things that some people would feel that they want to consider can be consideration for the use of certain hormonal um,
Right,
tablets
right.
um, because it's there is some talk about that delaying fertility, so or not having children can be its own risk factor to ovarian cancer. But of course,
Right.
that's not pronounced.
I
Sorry?
said, oh, okay, that's news to me. Right.
Yeah. So the thought is that because there is no natural break in this would be the theory, because there's no natural break in the continual ovulating, and that almost like constant monthly um, need to ovulate, it just carries on causing insults to the ovary.
Okay.
And
Mhm.
yep, but if one was pregnant, then that natural sort of 9 months to 18 months
Gives you a
when
break.
they are
Mm,
not having ovulation,
right.
yes, it can be something that can now aid it in the future.
Interesting. So, are you saying that a woman who's older and had children or hasn't been pregnant could
Yes.
have a higher risk of ovarian cancer? Interesting. Mm. Okay. Okay. Amazing. 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 Thank you so much, Dr. Shakes. This has been amazing information and education. Honestly, I've learned new things today. And if you have any questions for Dr. Shakes, join our community. Send us a message. Ask the question. We will get Dr. Shakes to answer it and come back to you um on the question. It's been amazing conversation tonight, Dr. Shakes. Thank you so
Thanks
much.
for
Uh,
having me.
if you wanted to leave words with women tonight, what would you say around awareness and proactiveness
So
regarding?
for me,
Mhm.
so For me, I think us having the conversation just means that at least women are thinking about it, not necessarily thinking about it like feeling that, oh, that's it, I definitely have this. But if in the future they were to develop certain symptoms, if they get into the menopause and they were to develop certain symptoms, then at least it will be enough, not another, should I say, nugget of knowledge that
Mhm.
they already are aware of. And questions they can ask their doctor, their GP, that, oh, do you think it might be such and such? Because it is possible that the doctor is now able to better explain, for example, how it isn't anything to worry about.
Mm,
Then also, obviously, if it means that by us having this talk,
mhm,
some people that have been listening would have been able to recognize some of the possible lifestyle choices they can make, especially in or around healthy weight, healthy diet, that can assist in at least, should I say, modifying those risk factors.
mm,
But yes, it's just the awareness that it's out there, the awareness that there are treatments, the awareness that even though it is difficult to screen for,
mhm,
it can still be straightforward to diagnose when
mhm,
we start thinking in that lane.
mm. Interesting, amazing. Thank you so much. And also for
You're
me is
welcome.
know, checking around if you belong to a risk group, honestly, and requesting some of those tests. If you belong in the risk group, and basically being proactive because your wellness, your health, your responsibility. And we have to be proactive and get the help that we need. And if something doesn't seem right, honestly, there's nothing. I always say there's nothing like doing too much. If something doesn't seem right, I'd rather be pounding and making noise at my GP and say I need to get this checked out, than just say nothing and just wallow there. And it could be something serious. So yeah. And also for me, also the takeaway is especially with women in menopause, because there's so many of these menopause symptoms that honestly that kind of mirrors some of this that we've talked about today. And so it's about being able to know the difference and say, okay, don't let's put everything as menopause symptoms. Can we check some of these things out, especially if they're persistent? I know that menopause symptoms too are persistent because you're in menopause. But also for me, my own takeaway today is also thinking through, apart from doing all of this tests and seeing what group, if you belong to the high risk group, is also ensuring that we're not passing everything as menopause symptoms, honestly, and doing a bit of more digging, you
Yeah.
know. Yeah, yeah.
Thank you.
Uh, Thank you very much. I hope this has been helpful for someone or people, and thank you for joining us tonight. Thank you for being patient with all the technicalities we've had tonight. And thank you, everyone, and have a lovely evening. And we see
Thank
you
you.
next 2 weeks when we'll be talking about PCOS. And in the meantime, have a lovely, lovely evening and a great rest of the week. God bless you. Thank you, Dr.
Thank
Shex.
you. Thank you.
Glad
Thanks for having me. Thank you. Bye.
once again. All right. Have a lovely evening. God bless
All
you.
right.
Thank you.
Bye.
Have a good night. Mm. Thank you, everyone. Thanks for joining. I hope you've learned a thing or two. I hope this has been useful. Have a lovely evening, everyone. God bless you.